Hi, friends. This is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is for those people who know that there's a better way towards health and wellness. They just don't know what that better way is. And very often it's right outside their back door. So today I'm excited to have Pam Kozy, and we'll be talking about Eden Energy Medicine. Pam is a certified Eden energy medicine practitioner. She's been that for 17 years. She is a Reiki master teacher for the past 21 years, member of the International Association of Reiki Professionals, and a reflexologist. Today, we're going to concentrate, amongst all that great stuff, just on the Eden energy medicine. I was first introduced to energy medicine by this book, which somebody recommended to me in the 90s. And you can tell because the binding is really creased. I have sticky notes sticking out of it. This is a resource on my bookshelf that it never fails to give me a place to start with healing or centering or helping somebody else. It is worth 10 times every penny you would pay for it. And then I don't know if you remember this, Pam, but years ago I did come to see you and you did your
Yes.
assessment and you were so sweet. This is when I had 2 practices, 4 doctors, 40 employees, and you're so sweet. You said to me, "You look so calm, but your triple warmer is out of control." And you gave me
Yes.
some
Yeah.
exercises to do. So I don't know if we'll talk about triple warmer at all today, but I'm sure that's an epidemic in our society. So where would you like to start?
Well, I'm just going to give a real quick briefing on my beginning with energy medicine. I was teaching some Reiki classes and I went to a store to buy some books for my students, and there was a big orange box that said energy medicine kit. And I had been doing Reiki and reflexology for a while. So I thought, energy's energy. This looks interesting to me. So I picked it up and I brought it home, and it was about Eden energy medicine and about this amazing woman that for the past 30 years has used herself in many ways and her issues to come across all of these things that are now amazing tools, which prompted her to write that book. And her husband is a psychologist, so they also use energy psychology. So anyways, I brought that home and my husband just looked at me, as many do when we're in this field. The field of unknown is what we use.
I love it.
And I had used to work in a hospital. I was in the hospital for ER for 5 years and ICU for 5 years as a unit secretary, then moved to CNA. And when I left there, thought about nursing and instead went alternative and went integrative. And that's what opened me up to all these things that I'm doing now. But I just remember getting a postcard the same day I bought that book in the mail, and it was from Donna Eden saying that she was going to be in St. Louis and that there was going to be a weekend seminar. And I just looked at my husband and he goes, "I know, we're going." And I said, "Yes."
That's what I talk about in my book, Self Health, is like these these discoveries, unplanned discoveries.
Completely and totally. So that was my venture. Actually, 18 years ago, I met her. I took the weekend workshop and met a naturopathic doctor by the name of Vicky Matthews, which was like Donna's right-hand woman at the time. And she was doing, in Chicago, we would go once a month on a Saturday and learn energy medicine. And fell in love with it immediately. I clicked with it. It was amazing. Reiki, as most people know, is just very simple, gentle, but it's very profound. But this, you're getting in there and you're doing a lot of acupressure work. Most of energy medicine is some form of acupressure. We use all the same points as an acupuncturist, but we're using our hands and we're holding acupressure points. What I love about energy medicine is it works with the meridians, which is very Oriental medicine. but it works with the lymphatic system, neurolymphatic system, neurovascular system, all of the acupressure points for all of these systems. And Donna discovered by putting those together with Qigong moves, Tai Chi, yoga poses, all these different things, but including massaging, tapping, stretching, pinching. It sounds so bizarre, but we're actually working with points that connect to the organs in the body, but more important, connects with the human energy system. Energy medicine blew me away when I realized how connected our body is. When you're a medical person, you're thinking of you need to feed your body to get the energy. You need to move your body to get the energy, but it's ingested. We never really relate to things that you can do outside of your body or to your body that is going to improve the way your energy flows.
Wow.
That's energy medicine.
That is so cool. So
Yeah.
keep going. I don't want to interrupt you. So then how did your road then flow into
Okay.
where you are now?
Well, again, 17 years. Oh, no, it's been 18 years now, maybe 19. I opened a center in Highland, and I was one of the only centers in Northwest Indiana that provided alternative therapies with some medical therapies. I actually was doing the Reiki. I had other people in there doing yoga, Qigong, different things like that. But we also had a mental health counselor in our office. Unheard of back then. It's almost unheard of now. You never thought that. And so it was amazing. I was probably with my office for maybe 5 years. And all of a sudden, I started seeing other centers open, mixing. Integrative is what they call it, because we're mixing the medical world that we're more familiar with the Eastern culture less familiar with.
And you know what, Pam, it's probably because of you that I have this tagline, and very often it's right outside your back door, because here we are in Northwest Indiana. It's not like a cosmopolitan hub for anything. And here we are, and there's so many amazing practitioners like you that are offering this alternative way towards health that tries to get people away from the hold of the pharmaceutical industry and all of that, and using our own body. It's so just mind-blowing and amazing.
The importance of that, Nancy, is two things. When I left the hospital, one of the doctors that I knew really well said, "What are you going to do with this?" And I said, "What should have been done a long time ago." I go, "It is so important. We treat the illness, but we're not treating what's bringing a lot of this on. We bring them to the hospital, we poke and we prod and we do all these things, which is so frightening, but we're not looking at the fear in their eye or how we can calm that down." So that's where the energy medicine to me was amazing, because by sedating triple warmer, by the way, is the one meridian in the body that's not just a meridian, it's also what we call a strange flow or a radiant circuit, and it can travel. So it takes energy from wherever it needs to, except for the heart, because the heart helps us stay alive. Energy medicine is our fright, fight, and flight energy.
The triple warmer?
Triple warmer, yes. So when you use that triple warmer and you're really nervous or you're upset or you're frightened, it kicks in and it warns you. But then it's supposed to calm back down. But if you suffer from panic attacks, anxiety, or if your life is stressful, or if you're doing too many things and caught up in that you don't even realize what's actually happening here. You don't feel right, but you don't feel bad. Well, it's because you're pulling from your adrenaline, the adrenals. Triple warmer, if we use it in energy medicine, Eden energy medicine, she taught us to sedate it and calm it down by massaging or very gently moving that energy to calm down. And if you're in that place of panic for too long, triple warmer gets frozen and it stays on. And then we start seeing all these other symptoms that we normally wouldn't see. And I'll have people come to me that, well, it's such a common statement. I've dealt with these things all my life. I don't understand why I can't handle it anymore. Well, they've drained their reservoir of energy and joy. So by sedating triple warmer, you have to kind of retrain the brain, retrain the neurovascular, the neurolymphatic system, retrain the body to only react when it absolutely really needs to. So yes, Nancy Triple Warmer is a godsend because it kicks in when we need it, and it helps to send adrenaline to wherever we need in the body. That's important. If you're having anaphylactic shock, or if you have asthma really bad, you can actually not sedate it, but turn triple warmer on even fuller to help relieve you of that.
Wow.
But again, once that happens, then it should naturally calm down by itself.
Mm-hmm.
We have to assist it by tracing it backwards or holding actual triple warmer sedation points, which are acupressure points,
Mm-hmm.
help achieve that. So that's one of my number one tools for anyone that comes into the office, is to check where their system is. If more than one acupressure system is out of whack, I'm going to go straight for triple warmer because they're probably overextending themselves.
Right.
Energy medicine has been a big tool in the world of cancer as well. I've worked and volunteered with cancer patients for over 17 years. And of course, we've always done the Reiki, which we find is wonderful, and it is. I'm never going to, it's one of my first things that brought me to where I am. But with the energy medicine complements medicine so much. Obviously, if we are in an accident and something ruptures, an energy medicine practitioner is not going to be able to help you. You need a doctor. You need someone that can sew you up, stitch you up. Medicine. I'm not totally against medicine, but I love the fact that with energy medicine, I can actually help someone determine how much of that they really need to take, what's good for their body and what might not be good.
Wow.
Through kinesiology, so we energy test. People thought energy testing was, they used to call it muscle testing. But in Eden Energy Medicine, I teach people how to energy test to see if their body is accepting something really well or not.
Excellent.
So, tool. Energy psychology is part of that, and we do tapping. What are we tapping?
Yeah, what is tapping?
Tapping is EFT. It's an amazing form of connecting with the meridians, but calming. It's a freedom technique, energy freedom technique, just emotional freedom technique. So we're just calming that down, EFT. But in Donna's way, she started out with her husband, who was a psychologist, to do tapping on all these acupressure points. And there are so many studies on EFT. So I highly recommend that as well. And we do that in the office too. But it's all a form of energy medicine.
Mm-hmm. So tell me, when somebody first comes in to see you, brand new to this world, brand new to you, what's the process for them?
Well, I first want to ask them what's been going on. Why are they there that day?
Mm-hmm.
Some people, it's just their answer is, I just wanted to try this out.
Sure.
That I just do a very gentle assessment. I might energy test to see if how their energy is flowing, which is
And
a real.
how do you do that?
Okay, so to energy test someone, what I normally do is there's acupressure points that you can touch. And I would place my hand on that, and I would have them hold their arm out. And there's a certain way, because in energy testing, there are different ways that you hold your arm or your body, and it connects with a different organ or muscle in the body.
Ah,
So there's a general test where you would hold your arm out, and then the practitioner would just have the person to hold. They don't tell them to be strong about it. And they would ask them a simple question like what their name is, because you should know what your name is. And then we would very gently touch there. And if they're saying the correct name, they can hold pretty strong if they're healthy. Then I have to do something that'll make it so they'll go weak. So I might pinch a muscle there. which alarms them. It kind of, surprises them, but it breaks the connection of energy. So then I go back, and this time I will ask them to say that their name is something else, something familiar with. And then I'll test. And most of the time, 9 times out of 10, they'll go completely limp, and they'll just look at you like, how did you do that? Because they're still, I go, well, your body knows you. And it's not 100%. There isn't any testing, even in the medical field, that's 100%. But with energy medicine and with using energy testing, we can be fairly accurate about most things. I wouldn't depend on that for if something is severely medical going on, but minor allergies, or if a person is just exhausted, we can actually energy test them to see if maybe their energies aren't flowing in the right direction. They could be flowing backwards. When we're exhausted, have you ever thought about, you're walking through your day, and there's sometimes that just taking one more step forward is exhausting. You've overextended yourself. But if you walk backwards and you just take time, it's like, well, that felt pretty good.
Wait a
because
minute. You literally walk backwards?
You get that. One of the tests that we do is we'll have them walk backwards. If they walk forwards and they go like they're weak, then that means that they're exhausted, that they've extended their amount of energy. But if they walk backwards, even if it's only just a few feet, and test strong, which that means that their energies are flowing backwards, or they're tired and they need to do some work on themselves. Whether we do what's called the daily energy routine. I love that routine. Donna created that.
It's in the book.
Energy medicine. Yes, Eden Energy. And it has to be Eden Energy Medicine with Donna Eden. She created a daily energy routine that takes maybe 7 minutes, if that. But it's tapping on specific points. For an example, there's one in there that's 3 or 4 thumps. If you touch here, this is the 27th acupressure point of your kidney, but it's also to boost your immune system. So you would tap there to boost your immune system. If you had something to do with your autoimmune, you would go to the thymus, which is located about here on the sternum, and you would tap there, and it activates the autoimmune. So we start doing these thumping. There's another one that you actually touch the sides of your, like underneath your arms, but kind of like just a bit by the rib.
Like right here, right there, right?
Well, a little bit lower.
A little bit lower.
Yes, that's a spleen acupressure point. And when you tap there, you're helping to process your emotions, but also sugars that go to the pancreas. So Doc found all these things out, again, by just doing, and found out this certain routine really helps specific things. And if you do it on a daily basis, 5 minutes of your time, notice that your energy's better, that you feel better, you are more focused, because a lot of it has to do with crossing. In medicine, we already know that the right side of the brain controls the left side of the body, left side of the brain controls the right side of the body. But if you ever pay attention to the human way of doing things, we very seldom cross. We walk straight forward. Even our jumping jacks, they're not. So we're doing a lot of things that are uncrossing the mind and the body. But when you start doing things to where you deliberately cross, everything begins to connect again.
Wow.
Energy medicine. So it's about feeding the energy body from the outside, whether you're tapping, massaging, stimulating, all of those things can really help boost you. If you haven't, and another thing, if you do have a medical condition, sometimes it can help the doctor if we rule other things out, which might be emotional. Because a lot of emotional problems that we have can cause us to feel physically ill. I get a lot of patients from doctors when they've exhausted it. They've done testing, they've ran all these things, and they've come to a standstill because there's nothing on paper showing anything. So then I get a phone call or a referral, and they'll say, we need for you to check this person out because we're stumped. And if we can actually find something and start working with them, and within 2 or 3 days, they're feeling better, we know that it had more of an energetic, emotional component than
Wow.
physical. So yeah,
That's
that's
fascinating. So the fact that you get the referrals from a medical professional or people in another field, that's awesome. That's true integrative.
it is. And that's the other thing that we're trying to do more and more. We really need to, I can't tell you how many nurses and doctors use at least a daily energy routine, if not sedating triple warmer. That's a big one for everyone. New parents sedate the baby's triple warmer if they're having,
Wow.
because babies are very hormonal. Think about the first year of their life. They are growing phenomenal rates. They are gaining weight. Their body is moving in such a direction in 1 year's time more than what we do in any other time in our life, except for maybe teenagers. They have that growth spurt again, but there again, it's hormonal and it
Mhm.
has with those things. And that can cause havoc with your energy system, which also can cause havoc with your ability to stay calm, to be able to use the hypothalamus in the body to keep yourself relaxed and calm. So,
That's a great tip. A lot of our insiders, we call them, and our connected insiders are grandmas who are they're caring for infants, helping their sons and daughters out. So this would be a great thing to do. So even if they pick up Donna Eden's book, they would find it in there. Mm-hmm.
YouTube, you can go, anyone right now could go to YouTube and just type in daily energy routine, Donna
Mm-hmm.
Eden, and it'll take you right to somebody doing the daily energy routine. I recommend that to so many of my clients because I can give them a sheet. I can show them in my office. But by Donna having that on YouTube, anyone could go to that and just put in daily energy routine, Donna Eden, and they will do the routine with you right there. And it's
Oh,
just amazing tool.
that is great. I mean, if so for my podcast listeners, my goal for them is to improve or create this whole network of alternative providers so that they have more tools in their toolbox. So I'll make sure I link Donna Eden's YouTube video for the daily energy routine in our show notes.
Well,
That,
and also one of Donna's instructors. I took a 2-year practicum back 17 years ago. It was a 2-year brand new. Before she just did workshops. And then she had enough of her instructors that would help that said, we need to put this into motion to be an actual scholastic program. And so we did. And we were the first ones in a 2-year class to be advanced practitioners or certified practitioners of energy medicine. And to also, I do instruction for women in energy medicine. I teach classes. Teach classes on how to do the fundamentals of energy medicine. Um,
mm-hmm.
Absolutely hook up with that as well, and then use the YouTube as a tool after class. So I've taught many people just the basics of energy medicine, but that was the best investment I could have done. And then we still have to renew our certification every so many years as well.
So that's a 2-year program, right?
Now it's a 4, but in the beginning it was a 2-year. Well, for me, I wouldn't need the last 2 because for me, year 3 was how to run a business.
Ah,
13,
okay.
and then there was only 2 classes in year 3, and that's for people that want to have a practice but don't. I already had my center when I
Right,
started Anna,
right.
and so year 4 was more extensive work. I would say more on a psychiatric level, on a more deep mental level, which is very important for practitioners as well. Here I have a counselor that does therapy, so we incorporate a lot of things. Her clients can see her and then come see me if I need to help them calm down after a session, or maybe they're not ones to really share. Isn't it amazing? We go to a doctor or a therapist because we need the help, and we get in the office and they'll say, so what's going on? And you look at them and it's like, Not much, you know, going on or that's going on. So sometimes when they see me first or one of my practitioners, it relaxes them so much that they start thinking and they have focus. And it's like, oh, so now they're ready to talk to that therapist
Oh, that's
because
very good.
it is wonderful. So I recommend it no matter who you go to. If you hook up with somebody that can relax you to that level and help pull things out and get things going, then it's going to make it a lot easier for you to recover in your therapy.
Absolutely. So the fact that the core program just to learn the practice of Eden energy medicine, the fact that it's 2 years tells me how complex that is. But
And
at the same time, there's very accessible things that you can do, like the daily energy routine, which is why I have so many sticky notes because I will look up like one thing, like I feel like I need to be more grounded. I feel like my root chakra is kind of like shifting, and I'll just research it, and there'll be some very specific things to do.
being grounded would be a stomach acupressure point or a bladder point. So
Uh-huh.
those can learn just by holding certain points. So the book is great for that because she shows you all those points so you can look them up to see what you need to do. But when it comes to the actual extensive training, you'd be surprised. When I was in that class, there was 240 of us, and we got all the way down to where we lost about 100 of them because they really wanted it just for self-help, and some of them were overwhelmed with it. But for those of us that really wanted to move on and add it to our toolbox and have it as part of our practice, it was amazing. I mean, there were chiropractors, there
Uh-huh.
were all kinds of different, therapists and doctors that were very interested in learning this because it's energy medicine, energy psychology. And so it really works on a deeper level. So absolutely, absolutely.
Wow. So now, I I think there's people that are open to this type of talk, and you're and people might think, oh, that's like hairy fairy stuff. Our listeners and our podcast viewers of this podcast, just because they're members, they're more open to things like this. And actually some of the things that you mentioned, like the energy testing and using your body as a tool, are things that I've used in some of the other courses that are part of this platform, the Instant Clarity course and the Instant Yes course. And it's funny when people say, well, that's just hairy fairy stuff. And I say to them things like, well, honestly, acupuncture's been around for 3,000 years.
It's one of the oldest.
And
Absolutely.
Ayurvedic medicine with the chakras, that's been around for thousands of years.
I teach chakra classes and people are amazed on how much more there is to chakras than the colors or, just knowing where things are at. It's very intricate part of the human body, the energy system, and they're all connected. Our meridians, our radiant circuits, our chakras, those are all terms an energy practitioner would use. Yoga is a prime thing for the chakras and opening up that energy system. But other cultures and other countries have been practicing these things for hundreds of years. So we're a little bit later, but they are finding and validating the importance of not just treating the inner body, but working with the outer body. Our body is 85 or more percent of fluid and electromagnetic energy. So we need to learn how to clear it, clean it, and to provide healing for our energy body. We talk about whole. That's the whole part of it. We need both. That's been my mantra from the beginning. I need to work with both parts, the medical community that we're aware of, and the more non-traditional, which to me is more traditional
More
because it's one of the
traditional.
oldest, you know, I mean, are the oldest that there is. And it's not magic because once you start working with people and stimulating these points or moving energy, they can feel it. They can feel things moving. They can feel the pain to begin to subside. And they just look at you like, that's amazing. I love it when someone comes into the office and said, good luck, because I'm very stressed and I don't know how to relax. And I'll get them on the table and I'll sedate their triple warmer and I'll calm their body down and I'll do a little bit of energy medicine and Reiki combined. It all depends on what I feel they need. And at the end of that, they are stunned. They literally are laying on the table and I say, okay, whenever you're ready, you can go ahead and get up. And they don't. They just lay there and they're amazed that something that seems so basic and so simple can be so profound.
Yes.
And honey, here, Nancy, you know that even with what you do, look at chiropractic back in the day when a chiropractor had to really prove themselves to what they were as far as the value. And now it's one of the mainstreams that we have in our culture.
Yep. And it's all working on the nerve system and the body to get the body to heal itself.
Absolutely. Absolutely.
I love it, Pam. Thank you. Thank you so much for the conversation. I know that our people listening are insiders. This is going to take them towards being now their own best expert. That's what I like them to do, is like learn about you, be your best expert, because no practitioner is going to be a better expert than your own self. This has been awesome.
We are absolutely the practitioner. And like I said, most people, like Donna herself, used her own conditions, her own problems to work on first before she ever introduced it to anyone else.
Yes.
And I think it's so important. It's not, oh, I read it in a book and now I'm doing it. No, I've experienced it. I've been a part of it. And that's what we all need to do. It's just to take that first step. Don't you think? We have to walk forward and just be a little bit willing to try something a little bit outside of the box, and then it'll become part of the norm. And I think that's important. All of my grandkids know how to sedate their triple warmer.
Oh my gosh, that's great.
And do any of those things. And it's great for studying for school, because what do? You get really nervous about testing and things, and it can help to calm that down. So you mentioned at the beginning of the podcast, you don't know how much we would mention about triple warmer, but it's a big one. It really is. And throughout Donna's book, even, she really talks about that. You can't say enough about getting the book. I do think it's a great idea, but I did want to mention as well that I do and I will be teaching some energy medicine classes coming up. Right now I've got chakra classes that'll be starting in September. But we have a newsletter on our website. So if they look up the website, they can actually print out our newsletter. We have recipes. We have things that people can look at to just kind of help them with some maybe meditation and things that they can do as well. So
excellent. And I know you sent me a bunch of information. We'll make all that information available to our listeners. Make sure that your website is on there so they can get the newsletter. I love the fact that you continue to teach so people can like really own these techniques and use them in their daily lives. Pam, it's been awesome. Thank you so much. I'm going to turn off our recording now, but stay on so we can chat a little bit when we're done. Thanks so much.
You're welcome. Thank you.